Hi, I'm Anne. I'm with the Hip and Knee program. You're going to be given this booklet about your knee surgery, and I just want to point out a few things for you to make note of. Up here we've got some contact information for your hip and knee navigator. If you run into any issues or have questions or concerns after surgery, you can give them a call and leave a message and we'll return your call when we can. As far as if you do need to talk to a nurse more urgently, there is 811. You can talk to a nurse any time of the day or night if you have pressing questions. If you have any chest pain or chest pressure or shortness of breath, you do need to call 911 and go to your nearest hospital. During the day, 811 also has pharmacists and physiotherapists available as far as if you have any other questions. You will be seeing physiotherapy before you go home. They'll make sure you know what exercises to do. It will be up to you to do your exercises 3 times a day. The first 4 exercises here we want you to do whenever you're resting. Your deep breathing and coughing to prevent infections in your lungs, and your ankle pumps to prevent blood clots. You can throw in some static quads and some over-the-roll knee extensions as well. Any of the exercises laying down are to be done on a bed or a couch, never on the floor. You'll do exercises 5 through 11 3 times a day. You'll stop after number 11. Physiotherapy will advance you to the harder exercises once they deem you ready, usually around week 2. The goal is to have a 90-degree bend, and if you're having any issues with reaching a 90-degree bend, we want to hear about it sooner or later. So call the hip and knee navigator to discuss if you're having any issues with your bend. On page 20, there are signs of infections to watch out for, as well as signs of a blood clot. If you have any pain in your calf and it's worse while you're standing or walking, we want you to go to your nearest hospital to be assessed for a blood clot. As far as swelling goes, we want to make sure that you limit your sitting to no more than 30 minutes at a time. We want you to get up, walk around, do a couple of exercises, and then lay down and elevate your leg higher than your heart. We do want to make sure that you do that several times a day, and more swelling means we want you to elevate it more frequently. When you elevate your leg, that's a great time to use some ice packs. Making sure that you don't put the ice directly on your knee. Make sure that you have a tea towel or a towel of some sort between you and the ice pack, leaving it on for 10 to 15 minutes, no more, but you can do that every hour. As far as constipation, we want to make sure that your bowels stay moving. If you haven't had a movement in 24 hours, make sure you do take a laxative. Everything's available over the counter, and your pharmacist is a great resource as far as medications that can help you have a movement. After knee surgery, you're going to have swelling, so making sure that you do use ice and elevation to help control the swelling. You may also be prescribed an NSAID, or a non-steroidal anti-inflammatory, something like ibuprofen or Advil or Celebrex even, and just check with your pharmacist when you're given your prescription to see if you have an NSAID. As far as pain control, we want to make sure that you use what's called a multimodal approach or a layered approach, making sure that you take your Tylenol regularly, as well as your NSAID or a non-steroidal anti-inflammatory, and then you can add in your narcotic. So making sure that you have your base of Tylenol with your ibuprofen, say, for example, as the NSAID, as well as the narcotic. Your nurse will be going over this with you on discharge as well. Some people report that there is a heat or a warmth that radiates from the joint intermittently for months after surgery, and that's normal and expected. You will have bruising after surgery. It's not a gentle surgery, so you will have some bruising, and don't be alarmed by that. As far as pain control goes, we want to make sure that you do control your pain, taking the medications regularly until the pain starts to lessen. So making sure that you set alarms and keep track of what you've had when. It's really easy to lose track after a few doses of medication, so just keep track of what you've had and when, so you know what you can take next. At nighttime, the pain can be worse, and that is because your body gets stiff from not moving. So if the pain wakes you up at night, get up, move around, do some bending exercises and try to get back to sleep. You can also use an ice pack, take your pain medications if it's close to them being due, and you can also sleep on your side. If you want, you can throw some pillows between your legs and have your buddy help you turn over and sleep on your side, making sure that your leg is supported. Typically, people like to sleep with the operative leg to the top, but you can sleep on whichever side you feel is comfortable. You won't do any damage. As far as the dressing, you will have a waterproof dressing on your joint, so you can have a shower. That being said, we want to make sure that your pain is well controlled and that you've had a nice big glass of water. Sometimes what can happen is with the hot water, your blood pressure can go a little bit lower. So making sure that you have your support person nearby so that you can have help if you need it. And make sure you use your bath chair. You can shower as often as you'd like. We don't want you swimming or bathing or soaking in a hot tub, but you can have a shower, that's okay. And then we will get you to change your dressing at 1 week after surgery. We'll get you to take off the old dressing, don't do anything to the staples, and put on the new dressing. You'll be provided this dressing as well as the instructions on discharge from the hospital. And then you will need to make an appointment to come back to the ortho clinic here at the hospital to get your staples out. And that's usually around 10 to 14 days after surgery, the appointment. So you can call at any time after your surgery to book that appointment. We'll give you a piece of paper that has the number to call to make that appointment. And if you have any questions or concerns, you can call the Hip and Knee Navigator. Thank you.